have an adult. So I'm Christy Blakely, and I do have an adult in the system. My Lauren, who was my firstborn, was born prematurely. It didn't go so great, and she has cerebral palsy. She's nonverbal. Lots of medical. She lives on her own with a significant other named Mitch, who also has cerebral palsy, is a quadriplegic, and uses a communication device. One is on the elderly, blind, and disabled waiver, which we will talk about tonight, and one is on the SLS waiver, supported living services. So we will talk about those tonight, but we're talking about the home and community-based service waivers, or HCBS waivers. And of course, there we go. So tonight we're going to talk about the systems navigation, but these are the things Family Voices offers. We offer systems navigation, and we call it that because it really is navigating systems and understanding what to ask for, what special words, the mother may I that you need. We do the education and training, which is what this is. And then we also do advocacy and policy. We are down at the Capitol. We are testifying on things that are important. And we are also capturing stories of how important Medicaid is for our individuals these days, as the world is kind of different. There's concerns. So Medicaid is a federal and state program. So the state opts into Medicaid, and then they're required to offer certain things specifically. And then on top of that, the federal government gives a match. It's about 50 cents, but that 50 cents, so that when we talk about Medicaid costs, we talk about like $25,000. Well, then that's really 50,000, but only 25 is coming out of the state of Colorado's budget. So there is a federal match for many of the things that are Medicaid. What Medicaid does is it covers low-income folks, and it covers folks with disabilities. And for the most part, we're talking about disabilities tonight, but there's all sorts of things that are covered by Medicaid that a private insurance doesn't cover. Expensive wheelchairs, augmentative communication, home health care, which is so critical to our families and staying in the community and safe, our loved ones. So this is a pyramid of Medicaid that gives you an idea. The state plan is the largest population. It's the folks that are either low income and or disabled, and it's the regular state plan Medicaid. And then you have to be eligible to get into that long-term care. And then beyond the long-term care are the benefits we call the home and community-based service waiver services. So those are direct services, those are transition services, those are services to bring people out of nursing homes into the community. It's also services to keep our individuals safe and in the community. So this kind of gives you an overview of how things are organized in the Medicaid world. EPSDT is a program that is basically a federal mandate, and it is the state services for children 0 up to 21. So up through the 20th birthday to 21, you get early periodic screening, diagnostic and treatment. And it is a head-to-toe screening that's supposed to happen based on the American Academy of Pediatrics periodicity screening and schedule. So vaccines and things like that are part of EPSDT, but was created primarily for children that are low income, because we need to capture them and do an evaluation early, often, periodically. We want to screen them head to toe. We want to get diagnostics, anything that might give us answers, and treatment, so that if there's something wrong, we can treat it quickly. And if you think about scoliosis and catching it early, and it's less invasive, it's less costly to cure, all the things. So that's kind of the EPSDT. What it does for our kiddos with special needs is it says, absolutely no hard limits. So if glasses are something your child needs, they can't tell you, like private insurance, you can only have one pair of glasses a year or in 12 calendar months. Medicaid says under EPSTT, children should have whatever they need when they need it if it's medically necessary. So we think of Medicaid as a house, and that there's different ways to get in. Some are normal and some are a little crazier, like in through windows. But there are different ways to get into the Medicaid house. And so some folks come into Medicaid through that adjusted gross income, or their amount of money, and there's no disability, it's just the household income. And so if everybody in the house is on Medicaid, chances are they came in through the low income door. Then we also, if you get any kind of Social Security or supplemental security income through Social Security office, Medicaid comes along with that because there's obviously a disability. So, and there are asset requirements. So typically we say no more than $2,000 liquid assets available to the individual. You could do the Medicaid buy-in for working adults. So you could be a person with a disability that is a working adult and buying into Medicaid, kind of like buying into private insurance, but Medicaid's a better benefit package for people in wheelchairs and people with disabilities. So you could come in that door. You've got to be employed. You've got to have the family restrictions are there income-wise, but there has to be a disability. Then you have the Medicaid home and community-based waivers. And those waivers add additional services than just what you would get if you came in through the MAGI or modified adjusted gross income, which is what MAGI stands for, in that door. So in the Medicaid HCBS waiver, there's other services specific to the disability that you have and the waiver that you're on. So there is a functional criteria. And we're going to go through some of this more specifically because we're going to go through each adult waiver. But there are definitely specific targeting criterias. But any which way, you're in the Medicaid house. Okay, so here, this gives you a little bit, again, modified adjusted gross income is what MAGI stands for. And that's the financial eligibility. So for a family of 4, you can kind of see what kind of income and you would still qualify for Medicaid. If you go over that income and you no longer qualify for Medicaid, that's when we have to find other ways to get into the Medicaid house because the Medicaid is the best benefit package. If I wanted to choose the best thing for my kid, if I had a child, a little one, it would be to have private insurance first and Medicaid secondarily, because then you've got reimbursement for providers and hospitals at a very reasonable price. And then you've got Medicaid secondarily that is saying, you don't have to balance bill. So you leave the hospital in January and you have a big bill, you're not going to be charged that bill, and children don't have a copay. Okay, I'm seeing a couple questions in the chat. Should I stop or should I keep going?
Just asking about sending out the PowerPoint, which I said I will do my best to do, but I will post it on the website for sure. I'll try to email it to registrants.
Okay. So a lot of our individuals, when they turn 18, will not be able to work competitively to make enough to keep themselves in an apartment or whatever otherwise they would be doing in a typical environment. So there is something called supplemental security income. It is under Social Security, and they both have the same acronym, but there's a big, huge difference. So supplemental security income, if your individual can't work competitively, you would apply for supplemental security income. You are limited to not having any more than $2,000 liquid assets. You're allowed 1 car and 1 house. So the income is sent to you through a bank account. And from that income, you're going to pay rent, you're going to pay, food and clothing and shelter and all the other things And depending how you came into Social Security, you may have to do a report quarterly or not quarterly, annually or biannually. But the disabilities that it's looking for are the ones listed under Social Security. And you can look up disability, Social Security, and it will give you the listing. It's intellectual and developmental disabilities, it's cerebral palsy, it's anything that impacts mobility, it's brain trauma. There's all sorts of, and visual impairment, blindness gets additional funding if you have that disability. So there's all these disabilities, but the supplemental security income should be part of what you do at the age of 18 if you haven't already done it. Okay. There's so much to do at certain ages and stages when your kiddo has disabilities. So we go through the school process, and we can go all the way to 21 in the school, taking, walking with a diploma and getting a dummy diploma, and then going on to a transition program, et cetera. But there's a lot that happens at 18, including sometimes having to change doctors because doctors don't take pediatric cases, and you have to move to an adult doctor. All those kinds of changes happen. But one of the big changes that happens for children is they become emancipated or an adult at 18. And the family has to get an ID so that they have an ID. The family needs to for my own daughter, Lauren couldn't write her name, so we had her sister write her name, and we made it into a stamp so that Lauren's signature is a stamp. She hits the stamp and the ink goes down, and she is aware enough to know that nobody should take that stamp from her wheelchair unless they have permission to be signing her name for something. So we did it that way. That's how we, handled that. Other people do teach an X and how to write the X, but they will, as adults, have to sign things whether they're able to hold a pen or not. So the access to things, records, we all know this with children. So there's certain times where you can get access to things, and then all of a sudden they're adults. I remember I had to call Social Security for Lauren one time, and she just approximates it, and they wouldn't wait for her talker. And I said, okay, we'll talk to her, and I've got the phone up to her. And I mean, it was something a little humorous, because I was just like, okay, you don't believe me talking, but you're going to listen to her try to approximate. And the guy kept saying, well, can't she hurry up? And I kept saying, no. And it's like they're supposed to work for people with disabilities, but they don't get it. Anyway, so it just is fun. But at 18, males have to register for selective service. They may not be able to feed themselves, but they have to register for selective service. They can register to vote, and should register to vote. They need to have a bank account, because supplemental security income is going to put money into a bank account. So you want the parent or caregiver's name on it along with the individual's name, so that other people can get at, so you can get at it. But all the things that happen for a reason. It just often catches us off guard, because the kid's 18, we still feel like they're their kids. And in fact, the state doesn't see them that way anymore. So, and then at 26, you can continue after 26 petitioning your private insurance to keep on. We kept Lauren until she was in her late 30s on our private insurance, because we felt like it was the right thing to do. It kept costs down and all. In today's world, where insurance plans don't always have everybody in network, they're very selective. It's harder today to be able to have private insurance and Medicaid and have them play together nicely. It's like two kids in a sandbox. Okay. One of the things we encourage you all to do with your kiddo is to talk about how they see their lives. This does a number of things. It helps you see how realistic they are. it helps you start to dream and have ideas around what could your kid do and what do they want to do. Um, you know, talking about where do you want to live? And the kid may say, I always want to be with you forever and ever and ever. And you go, oh, goody, that sounds great. No, or you say, you know, well, you know, your sister turned 30 and she doesn't live with us anymore. I mean, do you have any other plans? So talking at 5 and 10 and 15 years and kind of setting that out. Do they want to work? Is it realistic? You know, the kid with a bad temper may not be the best person to do a job with elders. I mean, I'm just saying, getting some sense of what your kid wants to do or sees themselves doing is part of the program. And then really pushing on your transition program or the school where your kid is going to say, you know, help me understand, because I've never transitioned a kid before. What should I be paying attention to? What do I need to do? What don't I need to do? Who helps them if they can't take themselves to the bathroom, but they want to work, right? Is there somebody that's going to be at the job site that's going to take them to the bathroom? All those things are questions. They're hard questions. They're conversations, I think dinner time conversations, but they're conversations to realize just how realistic, but also what else needs to be done and where are the holes in the plan, right? If the kid thinks they can live on their own by themselves and yet they've never washed a dish, we need to get some skills related to being able to wash dishes and make dinner and put laundry together and whatever else it is. So what do they like to do activity wise, and what care needs do they have? And this is a biggie for all of us in the care world, because if we are counting on the money we make in doing the care for the kid, then leaving the house may be harmful, and we need to pay attention to that. So all of those things are part of the conversation, and that conversation goes on for several years. You know, we didn't overnight get Lauren moved out of the house and you know, hooked up with Mitch and all that. It took a while, and it took some planning, but there's wonderful opportunities out there. So dare to dream. I really encourage you to dare to dream. I see a lot in the chat. Anything I
Yep,
should pay attention
I
to?
tried to answer a few as we went through, but before you get into all the waivers, how
Okay.
about talk about how parent income falls into Medicaid eligibility? So one question about how does parents' income impact long-term Medicaid eligibility?
Uh, so if the child is on a waiver, that income doesn't count against any caps in the home. If the kiddo is not on a waiver and we're in a MAGI household, again, modified adjusted gross income, and the income is low enough that everybody in the house qualifies, the money you make as a CNA, certified nursing assistant, counts against the household. It's a little counterintuitive, but that is the reality. So, um, again, if a kid's on a waiver, your income is kind of sheltered. If the family is on Medicaid, then that income counts against the household income. And it's the same as if you have grandma living with you and she has a pension. You have to count that because she's a person in that household. So it's all the income. Now, I don't get crazy about things like, uh, you know, teenager Sally is, you know, making $20 doing pizzas once a week. You know, some people want to report that. I don't know that that's that critical, but paying attention to being on a waiver makes a difference.
And I'd also add, like, charging someone rent means they're not part of your household, they're a renter in your house.
So there is a
Right.
document that Easter Seal has shared with us that is an agreement under supplemental security income to have them live in your house. How you come to those numbers are kind of where your house is and some comparables. Like you can go down to square footage and houses that are sold in a neighborhood, whatever. But the reality is, if your kiddo's getting $800 a month and you only want them to have $100 pocket money, then you're going to charge them maybe rent and food at $700 and then or $600, and you're going to charge the cell phone bill and the gas mileage or whatever, and you're going to come up to 700, so that 100 is pocket money for the kiddo. In some situations, if you're an authorized rep, which is under Social Security, you're authorized to manage that person's money, you have to report that money. So the more committed money, the less you have to qualify or search to figure out where you spent that money. Hopefully that makes sense. It's a negotiation that you have to make, and Social Security is counting on you making it with your kiddo. And you know, it's always different, right? I mean, Lauren didn't eat food, so I couldn't charge her food. So it was rent and gas mileage and, I don't know, cell phone bill, and maybe there was one other thing like household products or something like that, laundry.
Just
So
another question on that that I'm not sure the answer to. If you charge rent, then you need to declare that as income on your taxes,
that's
right?
correct. That's correct. So some families, they it's declared and everything else. Other families go get an able account and put the rent there, or I know families that literally put it into cash and put it in a lockbox. So everybody does it differently. There isn't one way to do it. Um, and if you really are, super concerned, find some legal advice, because there's ways to do this.
Awesome. I think that's it. I think you're good to keep going.
Okay, so under the adults HCBS waivers, and again, most of these happen to start at 18 because that's the year of emancipation, or when they become an adult. There are some that go longer, from the children's services, but we're not going to go into that. We're just going to say there's medical waivers and there's developmental disability waivers. So elderly, blind, and disabled is one of the waivers. It's one of the largest waivers, because it's 18 to 64, and then again at 65. Even though you have Medicare, you can still qualify for the elderly, blind, and disabled waiver if you have functional limitations. So think about the little old lady who's, 80 something, and she's got dementia and she can't take care of herself anymore. She could qualify for the elderly, blind, and disabled if she has a low enough income and no savings. So then we've got another waiver called and I'm going to go through these fully. So just hold on tight. I'm going to go fast here and then slow down. So then there's this new waiver. It's a newer waiver. It's complementary and integrated health, and it's for spinal cord injury. It's for having access to alternative medications, so alternative services, acupuncture and massage, and some of those things are within that waiver. Again, our waivers are set up specific to certain populations. So the community mental health waiver is for folks that have mental health. And it is a waiver that supports folks that may have a mental health break and lose their apartment and need additional services. There's the brain injury waiver. It starts at 16 because of driving, and the brain injury waiver is set up specific to brain injury. So day program for brain injury is one of the benefits. Under the developmental disability waivers as adults, the only two we have are supported living services and the developmental disability waiver. So the developmental disability waiver is the one with the waiting list, and it's something like 15 years. It starts at 14 when the kiddo qualifies for developmental disability as a 14-year-old. And the developmental disability waiver is the only one that has any kind of residential services. So SLS is you are living in your community. My daughter is living in her community. She has a developmental disability, but she's getting the services and she's not on the DD waiver. So she's getting the services she needs to be in the community. Okay, so the elderly, blind, and disabled, you have to meet the nursing level of care. So you have to need help with your activities of daily living. And the functional disability has to do with the functional ability to do activities of daily living, feeding, dressing, bathing, toileting, transfers, and mobility. So the elderly, blind, and disabled, again, largest waiver, people that are blind are on the waiver, elderly or disabled. And so it is the waiver that captures the most folks. It's thousands. I don't know how many. I can't tell you, but these are the services that are offered under the elderly, blind, and disabled waiver. So there is the consumer directed attendant support. That's home health care, kind of in-home support services, but it's more more self-directed. So you don't have the agency, home health care agency involved at all. You're doing kind of all of it. Home delivered meal, home modifications. Of course, there are limits on that per 5-year cycle with the waivers. There's life skills training, medication reminder, again, elders. So dementia and things, this is why we've got this medication reminder. We've got the emergency button, response buttons, the non-medical transportation. Debbie, did you have a question? Okay. So there's respite care. Again, if you're dealing with somebody with dementia, you're going to need space too. Transition setup is specific to coming out of a nursing home setting or a nurse facility, and whatever you might need in your own place. So that's the elderly, blind, and disabled waiver. So the integration, oh, I never can do the whole name. This name throws me. Complementary and integrative health.
It is
So
a mouth.
it is a mouthful. So 18 years, it also nursing or hospital level of care. So we're going to the community with somebody that could be in a nursing home or a hospital, but who wants to live in one of those. Sorry, but I don't. I would rather be in my community. So it is, this waiver was set up to reduce the trauma of a bodily injury. So whether that be a brain injury or multiple sclerosis or cerebral palsy, whatever it is, but it's allowing that person to then have access to other integrative services. So acupuncture, massage, biofeedback, all those kinds of things are covered in this waiver. So it's typically folks that are in wheelchairs or have limited mobility. So that's kind of what they're looking at. And the services that are available, again, consumer direction and the in-home support services, but you also have then things like homemaker. You've got the home modifications, but you also have the other things that assist you to have a better life, to be, cared for, but also have a better life. So all the things. There are certain things that are in all of the waivers just because it's a benefit that everybody would benefit from with a disability. Okay. The DD waiver, or developmental disability waiver, it's an intellectual and developmental disability. It has a waiting list, about 15-year waiting list. And the reason is because it's the most comprehensive waiver. It also covers residential services. So individuals that need to live with others or need support to live safely, All of those kinds of services are part of the DD waiver. And the DD waiver, whoops, no. The DD waiver has a lot of benefits. Honestly, it has dental benefits. Um, it has benefits planning. It has behavioral services because we're looking at people with developmental disabilities that may have behaviors. It has the non-medical transportation and the delivered meals and all the pre-vocation, et cetera. But it also is looking at covering somebody fully. So the family is less involved. The individual may live in a host home, and the caregivers at the host home are the ones making appointments and taking them to doctors and all of those things. Um, the individual may come home from the host home, you know, over a holiday or for a long weekend. But for the most part, they're going to live outside of the home, or the family is being paid on a daily rate. And I'm going to go into some of the differences between SLS and the DD. But there are budgets that come with the developmental disability. There are budgets that come with SLS as to how much the individual can have based on the level of need. And we're going to talk about that. Okay. The SLS, or Supported Living Services Waiver, you have to have a developmental disability, you have to be over 18, and you have to qualify for what would be an intermediate care facility. So again, a level of care that is looking at the activities of daily living, feeding, dressing, bathing, toileting, that you're going to need those mobility transfers, all those kinds of things you're going to need. And the SLS waiver has a very vast list of services, including assistive technology. So augmentative communication is part of that. Um, and there's all sorts of, you've got the consumer direction as well, but you also have day programs similar to what you have under the DD waiver. But it all comes out of your budget. So you've got to kind of figure out what you can get based on what score your child got. So it's a 1 to 6 under the SIS, under the supports intensity scale. Don't get excited. We're going to go over that. One of the things that's unique to the SLS waiver is the mentorship. That is allowing either having a mentor that can help, or somebody that can walk through helping make decisions or helping budget stuff, or helping with relationships that are tricky or difficult. So there is supported employment. There things like going and getting a job and having a trained coach, life coach, or work coach is available under this waiver. But again, you can't have it all because your budget is only finite. Your budget's very finite. But things like hippotherapy, massage, and movement are under the SLS waiver as well. So the big difference between SLS and DD, although it requires a developmental disability, is the residential piece and the more comprehensive coverage of your individual. So you do have some respite and everything, but again, you figure out the respite, you figure out some day program, you figure out some consumer direction, and you may be at budget. So you can't have everything. It's frustrating for families, especially because most of what's happening at 18 is there's unknowns. You don't know what that budget is until your kid takes the evaluation called the supports intensity scale, and then you'll know the number, and then you'll know the budget. But there's so much that's unknown, especially if you're making money as a CNA and you're counting on that money for your own household budget. It's very scary because there's some unknowns until you get all those numbers and in everything's calculated.
All right, Christy, you've got a couple questions before we go into the SIS.
Okay.
One big one is that transition from the CES waiver to the DD waiver without having to wait on the waiting list, and the panic that was caused by a memo that went out that wasn't saying what it meant to be. Can you talk about that transition?
Yeah. So, so, um, so, 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 they made some changes at Healthcare Policy and Financing, and that's the Medicaid agency, to say that children on the CES waiver should go straight to the DD waiver. What they found is that there were some kids that didn't fully qualify for CES and therefore didn't really qualify for the DD waiver, whether they were uh, less, I don't know, less disabled. It's hard to say, but they were saying this. So they said, we really need to stop and say, plus the DD waiver is filling up. There's only so many monies. There's only so many dollars in the DD waivers full. So they said, let's stop a minute and evaluate the kids coming off of CES and make sure they qualify for the DD. That doesn't mean they're not going to get in. It means if you're on the CES waiver and you're up at night and your kid has all sorts of needs and has an intellectual and developmental disability, chances are they're going to go straight over to the DD waiver, right? Meanwhile, those that qualified at 14 for the DD waiver years ago are still waiting. There are people that are actually waiting. When Medicaid said, okay, we're going to go to the people on the DD waiver and say who wants to really come over, many did not. Many were happy with the services they were getting, whether it was under SLS or EBD or one of the other waivers. They didn't really want to go to the DD waiver yet, because the reality is you can get most of the services you need under SLS unless you need the residential. And there's emergency ways to get to the DD waiver if you've been waiting. And that means, if the caregiver is failing, if the caregiver's gotten older and the caregiver can't caregive anymore, or if the person's going to lose a home, if they don't have a house to stay in, all of those are emergent to DD waiver. So it's not a one-time bite at the apple. There's way more options. And I have to tell you, Colorado is far ahead of any other state with this many options for adults with disabilities. Most have one, maybe two waivers, and very few have no waiting list. So every year when there's money in the coffers, which we all know there isn't this year, but when there is, people ask for extra slots, and then we call them slots because there's an amount of money per slot calculated. I cannot tell you what exactly it is, but I want to say it was like $63,000 per slot, something like that. And they buy down those slots and say, okay, we're going to put, 5 more people in, or 20 more people in, or 25 more people, whatever it is. But you have to have the money. And again, go back to the 50%. They really don't have to have a full 63 because half of it's federal money, right? Okay, so it's only half of that. So, but I would not panic, because there still is the ability from CES to go over to developmental disability. And my daughter at 42 is still on the SLS waiver, and I don't think I'll take her off. She's got a house and we've kind of figured it out. So there are options. So I wouldn't panic about not being able to go to DD immediately. And, I've had families over the years, and I've been doing this a long time, more like 38 years, because I was in special ed before I had my daughter. I've had families say, my kiddo is never going to leave me. I'm always going to have them at home. I never want anybody to take care of, Sally or Billy or whatever. And, those folks, the SLS waiver will be just fine if they're coming from CES, or they can go over to the DD and get the home caregiver allowance and that, that budget. So there are options. Anyway, it's
Yeah.
easiest if we do it one-on-one, because it's really hard to do it so globally, so big. But okay,
Yeah.
So another
The
thing,
moral of the story is you can switch from CES or CHIRP to
yeah.
DD without waiting on the waiting list, but you should make sure you actually really want to, especially that cap on the SLS waiver is going away starting
Mhm.
later this year, next year, which will make the SLS a lot more valuable to a lot of people. Um,
So, yep.
does mentorship fall under the employment part of SLS?
No, mentorship does not require any certain certifications, and it bills out at a higher rate than most things. It's really a very well reimbursed mentorship is. There's a
Then
limit on how much you can have, though. That you're only supposed to have so many hours of mentorship a, a month or a week or something. A month. Um,
Then does SLS also have vocational training that doesn't impact your budget?
no, to get that you would go through Division of Voc Rehab,
Okay,
um, or the SWAP program if the kiddo's in high school. But the Division of Voc Rehab will do training and find job without impacting your budget.
got it.
Okay.
And then here's another rumor that's been flying around. We always love bashing rumors or squashing
Yes, we're
rumors.
going to stop rumors.
Yes. Isn't the SLS out of funds to allow more people on? Curious as to what's happening to those who can't get on SLS due to funding shortages.
No, there's actually two. I don't normally go into this, but there's actually two SLSs. One is a state only SLS, and as it sounds, the federal match isn't there. But we have so many slots on state only SLS, and then we have the federally funded SLS. So there's two different SLSs. The community center boards, or the case management agencies is what they're called today, do have a handle on that, but there is nobody waiting for SLS. There should not be anybody waiting for SLS. SLS is something you can get on right now if your kid is 18 and qualifies with an intellectual and developmental disability. Um, so, I don't know where that came from, but there is no waiting on the SLS, and they're not out of money.
And then last one, if all budgets are being cut, how is SLS going up or IHSSB extended? So essentially, we're out of money. How are we expanding things is the question.
So most of what's happening this year is not expanding, and the tough thing is they will be looking, and to try to figure out where they can, stop or reduce. Um, and the last thing we're going to want to have happen is to reduce anything related to the home and community-based waivers, because the individuals that are on those are living in the most effective, efficient way possible by living in the community. I work with adults and seniors, and if I have to take somebody out of a host home and put them in a nursing home, I'm looking at 4 to 5 times the cost. Where I'd much rather see them in a host home where they're in a real home with real people, and they're not in a care facility. So, and it's cheaper. So it's smarter to keep our home and community-based services in place. Does that mean that they're not going to say, oh, could you cut 1 or 2 hours? Well, hopefully not, but I don't know where they're going to go because they're looking for ways to cut. So we've got to all be very vigilant about being good stewards of the funds that we do get and managing our kids to the best of our ability. And that's the best I can say, because we just don't know. There's two things you never want to see made: policy and sausage. And policy is part of what's going on at the legislature right now about who can cut and what can they cut. And we're down there with a voice saying, don't you dare touch our kids with special needs. Don't you dare touch our young adults with special needs. Those individuals are living efficiently and effectively in their community. Don't mess with them.
Love
So
it.
that's what we're saying. Anyway, okay.
So
More
the next
changes. Put on your seatbelt.
somebody yes, somebody has a SIS assessment next week, so we gotta get through the SIS stuff.
Okay.
Help
All
her
right.
out.
All right. So, and I'm always willing to do a CIS prep with you prior to your CIS because it is a different way of thinking. I just have to tell you that. The CIS assessment is going away in July. I'm glad you're having your CIS assessment soon because April 1 is the last day they will take any kind of CIS assessments or requests for a review of your level. The CIS is a norm referenced test that we paid money for to use. It ends July 1. Like June 30th, we will no longer have a CIS used. And they're going to change it to the ISLA, which we've looked at the ISLA. We're going to test the ISLA. I've even offered my own daughter as the guinea pig for the ISLA because we know what's wrong with the CIS. We don't know the ISLA yet, and we haven't seen how it's going to work. So the CIS is a test. The first part is a lot like that 100.2 that you do, where you're asked lots of medical questions, lots of, does your kid have suctioning, or do they need respirators, or do they use nebulizers, and is there any skin breakdown? All the things related to medical. And we have medical, and then we have behavioral, and then we go into the main part of the CIS, which is the level of support needed in each of these areas: home living, community living, lifelong learning, employment. And there's this many items on all of them. So the whole test itself takes about 2.5 to 3 hours. I always suggest a cocktail ready afterwards. Anyway, if you don't drink, soda pop is good too. The hardest part of the CIS for families is the fact that you're answering very abstract questions, and you have to say how much support, how often, and how much time for everything. So they may ask something like, your loved one is going to use kitchen appliances. And they're going to say, what type of support? How much time? How often are you going to do it? And then the daily support time. So if we put everything together, everything from the microwave to the VCR to the, remote, you have to answer. So if your kid is like mine, Lauren can't use her hands. She barely can drive. She drives by braille. It's great. She needs full physical
Drives
assistance.
her wheelchair, not a car by Braille.
No,
A
right.
wheelchair by
Correct. Her
Braille.
wheelchair. Yeah. But she needs full physical, right? To do that one question. This is just one question. And then I have to say, how often would she use appliances? Well, you use the microwave 3 times a day, or you use the remote 4 times a day. So now I've got 7 times a day. So I'm going to say, at least once a day, but not every hour. Then we go to support time, and we have to calculate that too. And we have to say how much time overall would it take if I started to add all those things up. Well, a few of these questions, and your eyes are rolling into the back of your head, I promise. So another one, like in the community, is your kiddo is going to go into a public building. What type of support? What kind of frequency? How often do you go into public buildings? Well, if you're not thinking voting, and you actually think about every building as a public building that you go into, school is a public building, and how often do you go into public buildings? Probably every day. And then how much time does it take? Well, to get in with the wheelchair and all the stuff and the automatic doors and everything, we're probably at 30 minutes to 2 hours a day. And they may say, oh, I'm sorry, you can't have that much. And you have to respond again and rethink it. But the questions are very vague. Your kiddo wants to be in an intimate relationship. What type of support? Frequency and daily support time in order to manage an intimate relationship. And you're thinking, my kid can't even like ask somebody to play on the playground. You know, I mean, it's really hard. And some of the questions are really out there, like your kiddo is how efficient can they do a job? And you have to think, okay, a widget, putting something in a little box, and can they do 5 or 10 of those in less than 10 minutes? And that's the kind of thinking. And so to get your brain around it, and we don't game the system. We're not giving away secrets or anything. All we're doing is helping you give the best answers, because this test is really supposed to answer how much help your kid needs every single day. And if you underestimate it, then they're not going to get the level that they may need real time if you went away tomorrow. And that's the big deal, is we want to be realistic. We don't want to say, oh, well, Sally can do everything by herself, when Sally really can't. I don't know why I'm picking on Sally tonight, but I am.
And
Okay.
none of us are super sad that the cis is going away.
We're not super sad. It's really not a very family friendly test. It really challenges families to think about their kid in ways that they've never thought. But at the same time, we at least know the problems. We know the barriers to it. We don't know anything about the ISLA at this point. So we'll be seeing how this goes down. But the last day that you can ask for any kind of changes is, I believe, March 30th, for any kind of level changes or anything like that, because they're preparing to go to the ISLA. Okay.
I just have a quick question. So
Yep.
when do you do the CIS? Is it like 2 weeks before they turn 18, or like what's the kind of timing for that?
Um, it is before they turn 18. There is no 2 weeks or any of that. What I would say is, if you've got somebody turning 18 between now and May, I'd be calling my case manager and saying, I want the CIS before it all changes. If you have a kid with a summer birthday, I'd be saying, get that CIS so that you're not in the middle of this total upheaval and we don't know how that other test is going to go.
Okay, so if it's June, go ahead and try to get the CIS.
I would.
Okay.
I would. Yeah. And I know they're already, the contractors that do the CIS are already starting to back up, because I had somebody the other day whose kiddo, I said, get it sooner. And they said it's like March 20th or something that they're finally getting it. And I'm just like, oh, so get them soon. Okay. So again, we're looking at adult waivers. Kiddo turns 18. You've been getting certified nursing assistant hours. If you're going over to the developmental disability waiver, the CNA is no longer, the funding is not for home health. It's all one daily budget, one daily rate based on the CIS score, 1 to 6. There is a 7. It is a negotiated rate based on the individual and the high needs, but 1 to 6. And there's an amount per day. It's a daily rate that you would get for your individual. And that should include not only the money that you are being paid for CNA, but also other care needs in the home. So, it's done by the level. So if you're going to SLS, you still have home health care in the way that understand home health care. You could also go to a consumer-directed model, either in-home support services or consumer-directed attendant support, where consumer-directed attendant support, you get an allocation. You don't get the allocation. It comes in a portal. You have the allocation, and then you bill against it, and you're paying out of that allocation, you're paying workman's comp and taxes and all the other stuff that you have to pay. So your hourly rate is calculated for the individuals, and then you bill for them. Okay. In-home support services. Let me do it this way. I think of home health in three kind of bars. Not bars like drinking bars, please. I'm being goofy tonight. I'm sorry. So you have full-on home health care. The home health care agency is billing for you. You are billing them. They are training you. They are responsible for your ongoing training and your all of that. The agency is fully in there. Okay. That is full agency. In-home support services is agency light. It is you are working for the agency, you are making a little more per hour because the agency isn't taking as much because they're not having as many responsibilities. They still have the continuing education. You still may have some training requirements, but you are allowed to do more under in-home support because you're out from underneath the Nurse Practice Act, which is what keeps us saying, oh, you can't do G-tubes, you can do G-tubes, you can't give medication. The certified nursing assistant under the agency, you're very limited. IHSS, a little less limited. Consumer-directed attendant support, you're very much less limited. Consumer-directed attendant support is what my daughter and son-in-law are on, and it allows us to have a budget and worksheet, and we pay people according to the work when they're working. So the first morning where they have to get everybody up and showered and toileted and everything, that is a higher hourly rate. And then throughout the day, there's less rate, but we have to put the budget together. We have to do all the scheduling. We have to do all the billing. But it allows, for quite a bit of flexibility. My daughter has tasks that are very much nursing tasks, catheterizing through a stoma and things like that. Our nurses under consumer-directed attendant support are allowed to do all of that. We just train them up. We just train them to prepare for Lauren and Mitch, right? They're not going to go to the nursing home and do the same kinds of things in a nursing home that they're doing for Lauren and Mitch. Okay, does that make sense, everybody? Any questions? No questions. Okay.
None in the chat so far.
So the case management.
Well, there is one. I just didn't scroll down far enough. I'm confused. Is CDOS separate from CNA, or is that how they get paid?
CDASS is different than CNA, and it is how they get paid. There's a monthly allocation, and you're responsible not to go over that allocation and to keep your budget sound. So CNA would be under the agency. You can have CNAs under CDASS, but you don't have to have a CNA license. And there's the requirements for ongoing training and things like that are within the person who's running the consumer directed. So at our house, we have a requirement of annual rescue, breathing and things like that, but we don't require somebody to have a certified nursing assistant license. And the reason we're spending this much time is these are all going to be options under the waivers come July 1. Consumer direction is a way of the future.
And then is CDOS for 18 and over?
So right now it is only available in the waivers that are for 18 and over. As of July 1, it's going to be more available in all of the waivers for children as well. Things we're waiting to see. Okay. Case management agencies are where you do a lot of the work with evaluations and service plans and deciding, your case manager is the main person that coordinates your kids' services. Case management agencies are done by county. I've had people ask recently, can I change agencies? It used to be something you could do. It was something that was an open, you could ask to go somewhere else. in today's world with case management redesign, it is less something that you're able to do, but it is still supposed to be allowed. But I haven't seen a whole lot of movement since that all took place. Anybody else? I haven't. So,
Very rarely.
yeah, yeah. And you're getting your point across. One of the things I had somebody call me this week and say, I don't know what they sent in. I asked for a level review increase, and I don't even know what they sent. And your case manager only knows what you're telling them, and they may or may not communicate all of it. And so asking to see, what did you submit on my behalf? I need to know what you're saying about, my kiddo, because we have the passion because they're ours and we're going to fight for them. And we need to be clear with our case managers in the same way to say, I don't want you turning anything in on my child's behalf unless I've seen it. And that's something you absolutely can do. We often don't because we're like, ooh, I don't want to poke the bear that's, giving me the money or going to consider unmet needs for my daughter or whatever. But we got to be, we need to be vigilant these days. We just really need to be vigilant. These are links to the waiver charts. There's a waiver flow chart as to, some people like the grid chart, some people like the flow chart. There's an acronym guide, there's services comparison, and on that services comparison is IHSS and an agency and consumer directed attendance support. So you can get your information that you need. The buy-in for working adults is easiest explained. It's 16 and over because they're looking for like spinal cord injury, who can work, but still needs Medicaid because private insurance isn't going to cover their, I don't know, ostomy care products or their catheterization products. It's just amazing what private insurance can turn down these days. And so Medicaid, because it's used to people with disabilities, is better, is a better plan for people that use wheelchairs and technology and durable medical equipment. And so if you have an individual who's a working adult making money that's over the Medicaid threshold, then you can buy into Medicaid and get Medicaid as your private insurance, or Medicaid as your insurance, so that you have coverage. And there's income requirements, but it is about 450% of the federal poverty level. So somebody that can go and get a full-time job, where my daughter is not able to work at a competitive level, if at all. And so, we don't do the buy-in. She just has Medicaid through the supplemental security income. Okay, how
Christine,
to
there's
apply?
another question if you want to address it. Is there a flat amount of money for services on the EBD, or are individuals assessed using a tool like the SIS for the others? So how do they do budgeting for EBD?
That's a great question. Hold on. I know it. I'm just struggling here a minute. Hold
Yeah,
on.
there's not like a
Uh,
cap, but I didn't know if there were caps for certain services.
there is budgeting with the EBD, but it's done, I think, based on the 100.2, and then there's a set amount per year that they get. I know Mitch is on EBD, but he also can get consumer directed attendance support. So he has an amount of money for services under EBD, and then he has an amount of money for the consumer directed attendance support for his home health.
Got it. But there's no SIS. You don't have to do the SIS for ABD at least.
No, you do not have to, and you don't have to have an intellectual and developmental disability. So, and if you're not sure whether your individual has an intellectual and developmental disability, the best thing to do is to ask for a Vineland or a adaptive behavior score. If you don't know an IQ score, then the adaptive behavior score If it's 70 or lower, the kiddo will be eligible for intellectual and developmental disability services. And that's the test, Vineland and the ABA,
Yeah. ABAS.
ABAS,
However they
thank you.
pronounce it.
Thank you, thank you.
ABAS,
I
however
was
you
like,
want to pronounce
what? I
that.
can't get it. The ABAS, those, that's executive functioning. So that's if you put your kiddo, down in an apartment, would they survive? And, if they can't open a can with a can opener, chances are they're not going to survive, that they need more care than that. So, it's figuring out what they need, really. Okay, so in application world, you're going to do the Medicaid application. In our world, the best thing to do is a Medicaid application, the disability determination also, because the disability determination is part of what gets you into the home and community-based services, demonstrating that you have a long-term disability, that think of that pyramid, you're going up the pyramid. And I don't know how to say it. I'm going to say it as nicely as I can. For those of you that are needing to do applications, I'm sorry, case management agencies and some of the others do not do as much with families or for families that they used to. And so finding somebody that can help you navigate, but even today, I had somebody trying to apply for one of the children's waivers, and they were sent some bogus application, and I had to call somebody and phone a friend and say, I don't think this is the right application, and you might want to check with that agency. So, today's world is very different, and we're here to help. We want to help. But I do, what I experienced at 18 was difficult, but at least case management agencies did a little more. So that's the best I can say.
And we won't charge you anything to help you. So
No,
feel free.
the biggie. That's a huge piece. Yes. Okay. I think I've done all of this. Did I? Yeah.
Yeah, I think so.
So you've, and there's financial eligibility and everything else. You just you kind of have to start in and get it. But, some applications you have to do annually, some applications you don't have to do every year. In the buy-in, you have to do it every year. But there's also the anniversary date of disability, which is something that didn't used to exist quite so clearly. And now, because of after COVID, it's really become something that's very clear that they say there's an anniversary date for your disability, which I've always wondered, if I've always wondered that we still have to keep proving that our kids are disabled. It's like, if she started to walk and talk, I think we'd make the front page of the paper, and somebody would know. I mean, I wouldn't keep it secret very long. So,
42 years was not enough to justify it's not going
yeah,
away.
no, I mean, I at one point said I would be a very rich woman if I had gotten a dime for every time I proved she's still disabled. But and then she took it away with and used that on somebody, and it didn't go well. So I've learned to keep my mouth shut a little bit. Anyway, okay. For kiddos that in today's world, both adults and kiddos that have mental health, behavior, or IDD, intellectual and developmental disabilities, and mental health and behavioral issues, there is something called creative or complex solutions, and each RAE, regional accountable entity, is supposed to be able to have meetings, and we often expedite these for the RAEs for families, because families that are in that mental health, intellectual and developmental, and they're just bouncing around in the system, kind of like a pinball, those families are not getting what they need. And so Family Voices has learned how to get these creative solutions set up and get people to listen, because oftentimes our loved ones are in pretty bad shape, are getting scary for us. And so we ask for those kiddos to get services. And it is the first time often these families all get information together, where they can get everybody on their team and the family isn't the one having to carry all of the communication. And there's some strategic conversations about the placements for these kids across the state, or whether they have to go out of state because we've just run out of places here that work for the kid. So just know this exists, or if you hear of somebody that's having a kiddo that's bouncing around in the system and not going to school, and the kid has mental health issues and all the stuff, just please raise that with them and tell them, ask for creative solutions, because what we know is the language has to be a certain way in this state anymore for us to get what we need. We don't always know the mother may I. We don't always know the right language to ask, but that's what that's called now. So pay attention to that. Okay. And the individuals have to be on Medicaid. And, I said all that. I said all that. This is going much longer than I thought. There's a lot of material. So these are all the people that
We've
you
had
might
good
think of to
questions along
have.
the way.
Yeah, well, it took me 15 minutes to get in too. That was so the outcome is always to find the best solution for the kid, but the best placement for the kid. Sometimes that's out of the home, just in order to get services or the needs met. And so we wanted you to know that. And then any kind of upcoming changes, yes, there are all sorts of changes coming. Community first choice is what they're kind of calling this consumer direction coming into the waivers, as well as the SLS budget. Home health and the budget are going to get taken apart, so they're not looking at each other. All of these things are going to be part of that community first choice. So July 1 is another time to make sure you've got everything in place before July 1. That's the best way I can say it. Because it's going to be another kerfuffle. We have a transition checklist. We also have these wonderful round guides that are two-sided, and they're school and career planning, and they give you a little bit of what to do when, if your kid is in these ages. And our wheel is age 10 to 26. The checklist is I think 16 to 26, and just gives you some ideas of what all you can do when. For example, EPSDT ends at 21. So the year of 20, have those wisdom teeth checked, because if they need to go under to get wisdom teeth removed, EPSDT is the way to do that. It's not, that funding is not as easy or flexible after 21. My throat's getting sore. And my information isn't up there, so there you go. You can call anybody else but me. No, I'm joking.
I put your email as a response to one of the chats too. So I already threw it out there into the world.
Yeah. And I'm happy to do a CIS prep. I like to do it with whoever you're going to have on the CIS, and I kind of go through the questions and help you think the way you need to think so that you are prepared. So questions, come off mute. I'm here.
You guys have done an awesome job or asking questions along the way.
Can you clarify when the CIS evaluation is going away? Did you say April 1st?
I did.
Okay.
I did.
And so someone turning 18 in October will be on the new evaluation.
Yes, you will be.
Okay.
Yes. And I don't think there's anything we can do to get around it. But what we are going to do is test it, both with an individual like my daughter with physical disabilities and medical, as well as a kiddo with, I say kiddo, an adult with executive functioning, so more autism, mobile, but having other issues, so that we're really testing to see if this test is fair. But there's always an appeal process. So if you end up with, a level 3, for example, a level 3 is I don't know, it's less than $200 a month. I'll tell you that. So, I mean, not month, a day, less than, hold on, let me give you real numbers. Hold on. So all of this is available on the website. Residential. Yeah, so a level 3 would be about $150 a day, $150 to $170 a day. So if you say, oh, but my kiddo, really, that's not enough, that's not going to cover us, then you can appeal that. You can say, I don't agree, and I also recommend putting together a document that says all of these needs need to be met. It's one of the reasons why I'm so passionate about making sure that you communicate realistically at the front end of the evaluation at 18, because otherwise you're not getting what your kid needs. And then if you go away, we're even more in trouble, right?
So the scoring and the option to still kind of challenge potentially a level 7 will be available on the new evaluation as well.
Yes.
Okay.
Yes. Level 7 is tending to be a lot of behavioral stuff. Somebody that can't go to the community by themselves without 2 people, because they'll either strip down or attack somebody or go off because of a noise that they didn't expect, whatever that looks like. So really, really, really high needs. But all of those options are available to you. Yes.
All right, here's another one. Do you know how the new ISLA model is done compared to the SIS? We'll know soon-ish. You know
We are
some.
on, yeah. So there are committees meeting that have been meeting for over 2 years, doing assessment, doing the hard work to really look at this. They have crosswalked questions across to the ISLA. And I can't even tell you what the ISLA stands for. What is it? It's like independent.
Interim support level assessment.
Thank you. Interim support level assessment. Okay. I have to tattoo that one on my brain. I mean, on my skin. So, but they have crosswalked. They have looked at it. We don't know how it's going to fare compared to the CIS because it hasn't been tried yet. So, it's one of the reasons why I'm putting my daughter out there as a guinea pig, because I want to see if she comes up as a level 6 like she is now on the ISLA. And if she doesn't, then we've got some hard conversations with the state about, gosh, it's going away, but what are we going to do? All of this unknown, I don't know about you, but it keeps me up at night. All of these unknowns scare me. But I'm passionate about it because I want families to get what they should get, as well as realistically meet the needs of their individual. Because I've seen it the other way. I've seen the dad that comes down with, I don't know, cancer, and the kid isn't in the right level of services. And now we've got all that to do on top of dealing with dad's cancer. It's just, there's a lot that can go wrong or go sideways with our kids. And that's why I want everybody to get what they should fairly, right?
Absolutely.
I just wanted to hop in and say that I'm in complete awe of you ladies, and I'm just so grateful that we have you as a resource. A lot of us are just in survival mode, and I'm just glad. And I know you guys are in it too. And I'm grateful. I'm so grateful that we have you to at least try to start guiding us through this. So thank you.
We are here to fight and represent you all, but we also know your voice is really important, and people need to hear it too. So we will continue to keep the information as available as possible, as we, especially with the budgets cuts and stuff like that. But thank you, Catherine. That really, it warmed my heart to hear that, because I feel like I went way beyond what I should have tonight. Talked too much. I don't know, but there's a lot of information in this PowerPoint.
Every opportunity we have to glean your experience and wisdom, I will take it all.
You know, when you're old as dirt, I mean, it's, but, yeah, no, I mean, I will stay in this world because, you know, my daughter's in this world, but, I really appreciate, families trusting us too, because it takes a lot. I mean, I always joke about when it gets to 18 and adult stuff, we're in your underwear drawer because financially we have to talk about some of the stuff that's not really comfortable to talk about, with the kids and all of that and how you balance all of that. Um, so we'll be there
Well,
for you.
awesome. Thank you all for coming tonight. Um, yeah, Sabrina, keep telling anyone and everyone how important Medicaid is. That's the biggest piece of what we're telling everybody to do now. We put a
Yep.
couple plugs out on social media for sharing your stories in kiddos' face if you're willing, and that we've been sharing with legislators and will continue to do to share how important Medicaid is amidst all of these things too. So we'll
Yep.
keep on fighting it all together and making sure everybody gets the care they need, and
Yep.
happy to share info as we go.
And happy to answer questions. Thank you so much. Have a nice evening.
Have a wonderful night, everybody.
Bye.